So the doc tells you he's going to knock you out, stick something in your bladder, clean out your prostate, and you're going to pee like a racehorse. Is there any truth to that? Hey guys, it's Dr. Haps here. So the question is, a roto-rooter on my prostate, do you need it? We're going to go over the different options to help with prostate problems, and stay tuned till the end where we'll go over some bottom line issues and pearls. So what's a prostate? A prostate is really a gland that functions to produce fluid to help the sperm to survive. Beyond that, it really just causes trouble. See, as you can see here, the prostate is an organ that sits between the bladder and the urethra. The bladder contracts and pushes urine through the prostate opening and out to the urethra. Now, the prostate, like I said, is a gland that makes a bunch of fluid. After we have kids, the prostate just really doesn't cause any benefit and doesn't have any real true necessary function other than contributing to the ejaculate fluid. So what problems can happen with the prostate? Well, you can have enlargement. In most men, the prostate will continue to enlarge as we age. Starts growing in our 40s to 50s, and as long as there's testosterone, it will continue to grow. Most prostates are about 20 grams, which is the size of a walnut. That's considered a normal prostate. But most men, as we get into our 50s, 60s, 70s, beyond, that prostate can be small apple, orange size, even grapefruit size. What happens in most men is that as a prostate grows, you're more likely to have some urinary symptoms. And that's where we as urologists can help you out. As the prostate grows, it causes an obstruction or just basically a mechanical blockage. It's really a plumbing problem. The bladder squeezes, it pushes urine through the prostate, and as that prostate grows, there's just less room for that bladder to push that urine through. So how do we treat these issues? Well, sometimes we just do nothing. A lot of guys come in and say, hey doc, my urinary symptoms are pretty mild. I don't pee like I used to when I was 22. I get up a couple of times at night, but overall, it's not too bothersome. And if that's the case, I say just leave it the heck alone, enjoy life, stay healthy, exercise, don't get overweight, and no medicines or any other procedures would be necessary. But if the urinary symptoms are bothersome, you have a weaker stream, you're not emptying your bladder well, then usually we start with medications. There's really 3 different types of medications. The first one that we usually try is called tamsulosin. It's in the family called alpha blockers. They help to relax the muscular cells within the prostate, relax the tone, and again, hopefully the bladder is able to squeeze and push through that prostate. Another medicine reduces the size of the prostate. They're in the family called 5-alpha reductase inhibitors. And over about 3 to 6 months, these medicines can reduce the size of the prostate about 30 to 40%. And in some men, we use a combination of both these 5-alpha reductase and alpha blockers to really optimize the urinary symptoms. Another medicine that we really don't know how it works is something called low-dose Cialis or tadalafil. They typically use that for erections, but they found that guys were saying, hey, my urination is a lot better. So it eventually got approved as a once daily low dose to help with urinary symptoms. And the side effect can be maybe a better erection. Not bad. So let's say the medicines are doing okay, but you have some side effects and they're driving you nuts. That's where we get into the whole concept of the roto-rooter on the prostate. Well, what does happen is typically these procedures are done under an anesthetic. There's a variety of procedures. There's so-called minimally invasive surgical techniques. A couple of them are sometimes we'll put clips. We'll look into the prostate, deploy these clips to pull the prostate channel open. The goal is to create an open channel so there's less obstruction to the urine, and ideally you get off the medicines. Another procedure that's out there is aquablation, where heated water vapor is used to eventually open the channel of the prostate. Each of these, again, are done under an anesthetic, and you typically have to wear a catheter for 1 to 5 days after the procedure. The hope is you'll get better symptoms in the long term after going some short-term discomfort and pain. And also a benefit is you can get off the meds, which for most men undergoing this procedure were either causing side effects or weren't working very effectively. A third procedure is called a transurethral resection of the prostate. Now, this is a more traditional procedure where under usually a general anesthetic, we'll go into with a scope, look at the prostate, and resect the tissue of the prostate that's causing the obstruction. Sometimes we'll use a laser to vaporize the tissue. Sometimes we'll use just cautery and electrical energy to mechanically open that channel and literally remove tissue from the prostate lining so that there's less obstruction to the bladder, so you can void with a better stream and a better flow. Most men will either stay overnight. Sometimes it's an outpatient procedure. You usually have a catheter for 1 to 3 days, depending on the timing and what's going on. Also, after the catheter comes out, most men will have some urinary urgency and frequency. The bladder's just not used to behaving against this new prostate, and it manifests itself as going a lot. Oftentimes, men will have some blood in the urine, and sometimes a clot falls off and you'll have a bunch of blood, but typically it's pretty limited. Overall, the goal is to say, hey, I wish I did this 3 years ago, and you have such a good stream and such a good flow. But it can take a few weeks to a month or a month and a half to get to that level. Lastly, and this is fairly uncommon, but men with huge prostates the size of a grapefruit, sometimes they'll need what's called an open, simple prostatectomy, and sometimes it'll be done robotically, where a small incision is created and the capsule or the rind is open, and that juicy center, I compare it to like an orange, that juicy center is removed, and then the capsule of the prostate is sewed together. All these procedures are quite effective and quite beneficial, again, for the right gentleman. What's the bottom line? Not everybody needs surgery or treatment for an enlarged prostate. An enlarged prostate is very common, and as long as your urinary symptoms aren't too bothersome, don't mess with it. That being said, medications and surgery can help improve your quality of life if your urinary symptoms are bothersome. So start with meds and go from there. And then if you're not having any benefit, go see your urologist. Hopefully this helps. Thanks for listening. I appreciate your time, and be sure to check out our other videos and subscribe to our channel. Thanks a lot.